Hello, this is Dr. Sagar Srinivas, lead consultant, Department of Anaesthesia, Critical Care and Pain Medicine at United Hospitals, Jayanagar. So today we shall discuss some facts and myths associated with anesthesia in event of the World Anesthesia Day, which is scheduled on October 16th every year.
Doctor, how do you decide which anesthesia is to be given for my surgery?
Okay, so there is a common question we get to listen from everyone. So the anesthesia what we plan is different for each patient, and it is decided based on the pre-anesthesia evaluation which we do for each individual patient, and the anesthesia plan is tailor-made or customized based on their age, their comorbid illnesses, and of course the final thing is the patient's choice. So all these things are done to give the patient a perioperative, uneventful and a pain-free period.
Will the spinal injection be very painful? Will I have headaches and backaches later?
No. These are like any other routine injections that we take. In fact, we even give local anesthesia before giving spinal anesthesia. There can be some kind of mild back soreness for a day or two, but the chronic backache is mostly never due to the spinal but due to wrong posture, etc. And coming to headache, with adequate rest and adequate good hydration, these side effects are almost never seen. We use the most thinnest possible needles now, so with that these effects are barely seen, so you need not be worried.
Also, will I suddenly wake up when you are operating?
So I assume you're asking regarding general anesthesia. So general anesthesia involves giving the patient multiple medications which will be going right through the surgery. So irrespective the duration of surgery is 1 hour or 10 hours or 24 hours, it doesn't matter, because we will be constantly monitoring your heart rate, blood pressure, depth of anesthesia, so that you don't get to feel anything and you're completely unconscious and you will not be able to move till the surgery is ended, and that's our job.
Can anesthesia cause memory loss or paralysis?
Well, this question can be answered under two circumstances. If the patient has received spinal anesthesia, the effect of paralysis lasts for a couple of hours after surgery and it eventually wears off. If the patient has underwent general anesthesia, the effect of muscle relaxants is reversed as soon as the surgery gets over in the operation theatre itself.
I'm scared of anesthesia more than my surgery. What if I don't wake up after the surgery?
Okay, anesthesia is relatively a newer branch of medicine, and it has grown beyond leaps and bounds in respect to what it was a couple of 100 years ago and what it is now. So we have access to most of the recent medications which are around the world. So, and combined with the state of the art facilities and the monitors what we have, anesthesia is one of the safest things you can see, because it is provided by qualified doctors who are anesthetists, and we will be monitoring you before surgery, during surgery and after surgery, so that you have a uneventful perioperative period.